We are going to discuss the chest X-ray of a specific disease on the basis of clinical scenario and radiological findings. The case is an 18-year-old presents with the sudden onset right-sided chest pain and shortness of breath. As a part of his workup, he undergoes a chest X-ray. And here comes his chest X-ray. Here the X-ray is given without any interpretation for your own brainstorming that how you assess the X-ray and how you evaluate this radiological findings on the first glance. Now coming towards its interpretation. Here is the same chest X-ray film with the highlighted interpretation. This is the central trachea. This is the normal left lung. Here is the normal appearance and position of the heart and mediastinum. And this is the lung edge with no lung marking visible peripherally. There is no lung marking beyond this edge. And inside of this lung edge, there is the normal appearance of the underlying right lung. This is the right side as mentioned above, and this is the left side of the patient. Then we evaluate the ribs and soft tissue, and we can see there is no rib fracture visible and no soft tissue abnormality present. Then we come towards the diaphragm. There is a slight blunting of the costophrenic angles on both sides, but no flattening of the hemidiaphragm, and this blunting is most probably due to the peritoneal fluid. When how we summarize this, that this is a chest X-ray which shows a large right pneumothorax, and there is no evidence of the associated tension. There is no underlying cause described on this X-ray, suggesting that this is the primary spontaneous pneumothorax. So this was the case, and this was the case of the pneumothorax, and this is the interpretation of the chest X-ray. Then now come towards the how you present your findings to the examiner. First of all, you have to describe the X-ray, that this is the PH X-ray of an adult 18 years old boy, and that X-ray is with adequate penetration and good inspiratory effort. No important areas are cut off at the edge of the film, and there is no obvious abnormality in the right hemithorax. A line can clearly be seen with the absence of lung markings beyond it, in keeping with the lung edge, and the aerated right lung is otherwise normal in appearance. The trachea and mediastinum are not deviated, and the right hemidiaphragm is not flattened. Reviewing the rest of the chest of the film, the left lung is normal, the heart is not enlarged, heart borders are clear, and there is no abnormality seen behind the heart. And there is minor blunting of the costophrenic angles, which may present small volumes of the pleural effusion, but the hemidiaphragms are clear and there is no flattening, and there is no free air under the diaphragm. This is the gas bubble of the stomach, but there is no air under the diaphragm. There is no free air under the diaphragm, and there are no soft tissue abnormalities or fractures. In particular, no rib fracture are visible. So this was the case of the right-sided pneumothorax, and this was the chest X-ray interpretation of this specific case and radiological findings.